My name is Jenny Kaplan. I'm a colon and rectal surgeon, and I work here in Seattle. I'm a colon and rectal surgeon, so I specialize in diseases of the colon, rectum, and anus. This includes cancers, inflammatory bowel disease such as Crohn's and ulcerative colitis, pelvic floor disorders such as incontinence and rectal prolapse, and also diseases like diverticulitis, hemorrhoids, and fissures. I enjoy all aspects of my specialty, from cancer to hemorrhoids. I also focus on minimally invasive techniques, such as using the surgical robot, and diseases of the pelvic floor. I work with our general surgery residents, and I'm involved in their teaching. I also do research in terms of pelvic floor disorders, looking at patient-reported outcomes and quality of life. Absolutely. We're able to give our patients minimally invasive surgery now and help them feel a lot better and get on their feet much faster after surgery. We're also studying new techniques and new treatments for colon and rectal disease and doing clinical trials in the field of diverticulitis. I love being able to take care of patients and get people feeling better. I like meeting people when they're sick and getting them through their illness and getting back on their feet. I also enjoy the collaborative nature here and getting to work with other providers to take the best care of people that we can. It's a great feeling when you can see somebody through their disease process to get them to a point where they're feeling better and they're back on their feet. It's really wonderful to see, and it's why I come to work every day. Absolutely. I think people are so resilient and they can get through really difficult situations. I absolutely am inspired by my patients. I think in terms of my field and in colon and rectal surgery, the patient is always at the top of the pyramid, and we really make sure that everything we're doing is for them, making sure that it's the right operation, the right treatment, keeping them in the hospital the right amount of time, and just making sure that both the patient and their family feel well cared for and listened to. I really try to listen to every patient and understand what's important to them, what's bothering them the most, and understand how I can best use my skills to help them get through what they're going through. I think patients are really benefited by the team approach here at Virginia Mason. Our providers work really closely together. We've got a lot of conferences where we discuss patients, and we make sure that we're addressing all of the aspects of their care and giving them the best care as a team that we can. I chose to work at Virginia Mason because it's a really excellent hospital. We've got great trainees here working with us, and I really liked the team approach. I feel that I can be very collaborative, taking care of patients, and that every provider that I work with is on the same page and wants to do the best thing for the patient. I really try to get to know them. I try to get to know where they're coming from and understand their disease. Some of that comes from communicating with their other providers and their primary care providers, and just getting to know them and understand what's important to them and how I can best help them. I love to spend time with my son, my family. We have a standard poodle who loves to be outside, so going hiking, cooking, spending time outdoors.